stem cells and what's the future of this medicine, or is it just hype? Experimental therapies using stem cells are being explored for stroke recovery, Parkinson's disease, and Alzheimer's.
Honestly, this is groundbreaking because it's allowed for more avenues in personalized medicine. The applications for this are usually in disease modeling, drug discovery, and there's a lot of promise for using these for cell therapy as well, potentially reducing like immune rejection risks.
Welcome to Health Decoded, your number one source for real health information, with your hosts, Dr. Alessi and Matt Tack.
Welcome back to another episode of Health Decoded. I am your host, Dr. Alfred Alessi.
And the co-host, Matt Tack.
Matt Tack, my guy. Well, welcome back. Today, we're going to explore some cutting-edge health and wellness topics, specifically diving into the world of stem cell therapy. We really want to separate what's fact, what's fiction, and kind of explore the potential for stem cells in functional medicine.
Yeah, and we also want to highlight some growing interest and debates surrounding stem cell treatments. Are they the magical bullet for radical healing transformation, or setting the stage for an in-depth discussion? We're excited to talk about it.
I'm excited to talk about it. This is something that we've been trying to pilot for a while, and really just kind of, I want to say, like organically came upon a relationship with a clinic who offers this and that we have, partnered with. And it feels like it was kind of meant to elaborate and kind of come into this fruition. So how you doing, man? First off, how are you?
I'm doing fantastic. Had a little bit of an issue last night. You know what? It's funny. You try to optimize your sleep, and sometimes you have sleep interruptions, So I'm figuring that out right now. I've had a few sleep interruptions. So,
yeah.
But overall, doing good, man. How about yourself?
I'm doing good. Are you tracking your sleep with anything, or?
I need to get back to that. So I was using the Whoop band, but I am going to go over to the Aura. It's just something that I think I can sleep with. I usually don't sleep with like various things like on my hand.
Yeah.
But I feel like data in general gets it. I think the Aura is probably some of the best value in terms of data feedback that you can get with it being on your ring, but not imposing you. Your wrists tend to, like, if you wear something on your wrist at night, I feel like it imposes you a little bit more. So I'm gonna try out the Oura ring.
Yeah.
How about yourself?
I'm wearing the Garmin, and it's nice because it's a 7-day, 8-day life on the battery. So I do wear it to sleep. It doesn't bother me too much. I can definitely feel it, but I like the tracking because I've noticed that if I can get a cold shower or do like a cold plunge, like later in the day, my deep sleep is like, it's almost like 1.5x. Like I'm getting another hour of deep sleep at night. It's awesome. So I've definitely seen that correlation, as well as like the nights where I get home late and I don't have dinner till like 8 p.m. Those nights where we're at the clinic late or something, that's affecting my deep sleep, so that I'm getting less deep sleep and less REM. And more than likely because my body's, still kind of metabolically processing that meal. I've switched from like a meal to just like doing a big smoothie instead, so it at least digests a little quicker. But again, man, it's like data, like knowing like, wow, those things are affecting my sleep. That's why I'm waking up the next day feeling like a little weird. But last night I played lacrosse until like 8:30 at night. So my, everything's burnt like real hot. But then I came home and I did a real cold shower before bed, and I got amazing deep sleep last night. So, little hacks that you can implement to obviously kind of make sure you're not disrupting that sleep pattern.
Yeah, that was something. We had something going on last night. And I told you, like, I wanted to go hit the gym and work out, but then it kept getting later and later. And I'm like, if I accelerate my heart rate, like at 8:30 at night, it's not something I want to do for my sleep. So I like chose not to work out last night, but those are things that I think about in terms of like, how late do you typically work out? Because we're usually those, midday guys, lunch hour, get in there, get out. So that's something I think about as well. It's just like, how do you kind of modify your heart rate to prepare it for sleep? That's a good word.
That's right. Yeah. Accelerating it either early or midday, but not like later than 4 p.m. or 5 p.m. That's good. Obviously, if that's the only time you have to exercise, then you'd make it work. But
You gotta make it work.
taking a day off every now and then when we're guys who are there 5-6 days a week is not going to kill you. You know, it's not going
That's
to,
right.
it's not going to derail your results. But
That's
cool,
right.
man. Well, that's good, brother. Well, sorry you didn't get the best sleep, but let's provide value here, man. That's the goal with this podcast. So we want to thank you guys for tuning in. As always, we really want to just separate what is real and what's, you know, maybe some fluff information. And so everything we talk about, we do a little bit of research into. We get some studies around kind of the information. That way, you know, we're on top of it. And these, you know, we're not going back 20 years for these studies either. We're sticking like, you know, very recent within the last 5 years, right? Stuff that's relevant and stuff that has some merit to it. So, you know, today we're going to talk about stem cell therapy and what does regenerative medicine look like and kind of the emerging world of this, because it is relatively on the forefront. And, you know, like anything, the FDA has their hands in it and they control a lot of it. And so there's like, what is FDA approved? And then there's like, what is available? And then there's like what is out there, right? And so, you know, there's if you go, you can find whatever you need if you go certain places. So we're going to kind of get into that. But first off, we want to obviously give a little background, like what are stem cells for people, listeners who may not even know what this is. And so stem cells are amazing because they are unique cells with the ability to self-renew, and they can differentiate into whatever they need to be. So basically the term is undifferentiated. So then as soon as they get into the body, or your body technically has them within the bone marrow, it's going to use them where needed, right? You injure your soft tissue, muscle, tendon, it's going to become tendon. You have a disorder with the vasculature, it's going to become artery tissue, right? And so this dual capacity allows them to play a crucial role in the body's repair and maintenance systems. They can develop into many different cell types in the body, especially during early life and growth. So at young ages, the body is producing mass amounts of stem cells to build you and to create that new tissue. And so there's really 4 types that you're going to hear about or see, or that are available, I should say. And so let's just touch on those real quick. So kind of the most popular is like embryonic stem cells. Now, these are derived from early stage embryos, specifically the inner cell mass of a blastocyst, which is typically around 5 days post-fertilization. And so these are pluripotent, meaning that they can differentiate into all cell types of the adult body. This characteristic makes them invaluable for developmental studies and potential therapeutic applications. So due to this versatility, ESCs are extensively used in research to understand early human development, and they're being explored as regenerative medicine. The next type is adult stem cells, or what we would call somatic or tissue-specific stem cells. So these are located in various tissues throughout the body, such as bone marrow primarily, as well as the brain and the liver. So they remain in what's called a quiescent state until they are activated during some type of disease or tissue injury or inflammation. So unlike embryonic stem cells, adult stem cells are typically multipotent, meaning they can differentiate, but only into a limited type of cell. So, for example, like a hematopoietic stem cell in the marrow can become various blood cells, but it's not going to become a neural cell or a muscle cell, right? And so applications for these are currently used in treatments like bone marrow transplants for leukemia patients. Research is ongoing to expand the therapeutic potential for these as well for other things. The next type is what we call induced pluripotent stem cells. So these are actually generated by reprogramming the adult somatic cells, such as skin fibroblasts, to then an embryonic stem cell state through the induction of specific genes. So these are a little bit more modified, right? And so these exhibit that pluripotency, which is similar to the embryonic, allowing them to differentiate into any cell type. And honestly, this is groundbreaking because it's allowed for more avenues in personalized medicine. And, the applications for this are usually in disease modeling, drug discovery, and there's a lot of promise for using these for cell therapy as well, potentially reducing like immune rejection risks, right? When you put something into the body, is the body going to accept it or reject it? That's always something to consider. And then the final form is the mesenchymal stem cells. And these are found in various tissues, including bone marrow, adipose tissue, and umbilical cord tissue. And these are multipotent as well. So they can differentiate into bone, cartilage, muscle, and fat cells. And they actually do have an immunomodulatory and anti-inflammatory property. So it's very important. These are mostly the type of stem cells that we kind of work with within our kind of boundaries and would focus on. And so they're widely studied for the regenerative capabilities as well, specifically in things like orthopedic injuries, autoimmune disease, cardiovascular conditions. And they're currently being used in clinical applications as regenerative medicine for treating osteoarthritis, degenerative disc or joint disease, and tissue healing. And so these have, vast applications for longevity as well. And so, within personalized medicine, which we talk about a lot, which is where we can just kind of do, explore the boundaries of what our body can do. These have a great, tremendous use. So, understanding the distinct characteristics and potentials of each type is fundamental for how we advance this regenerative medicine, field. And so developing different therapeutic strategies. And then, the research is ongoing to continue to unlock these capabilities, aiming to translate these findings into effective clinical applications down the line. So that's just the different types of stem cells that are out there and that you can see obviously being researched, but then also now being applied to different treatments.
Yeah, and there's many different applications of stem cell therapy, and I'm just going to dive into a few here. So the FDA has approved stem cell treatments, and these are the ones. So the most widely used and FDA-approved stem cell therapies is hematopoietic. So stem cell transplantation, it's also known as HSCT, primarily used to treat blood disorders such as leukemia, lymphoma, and certain immune system deficiencies. This therapy involves transplanting healthy hematopoietic stem cells from the bone marrow or peripheral blood to replace damaged or diseased cells. Emerging applications in regenerative medicine. Research in stem cells is rapidly expanding, as Dr. Alfred said, showing promise in a variety of chronic and degenerative conditions. As mentioned before, the number one being cardiovascular disease. Studies suggest that stem cells could help generate heart tissue after myocardial infarction, which is a heart attack. Early trials indicate that mesenchymal stem cells, also known as SMCs, may improve heart function and reduce scar tissue. That was from the Journal of American College of Cardiology in 2020. So stem cells, and what's the future of this medicine, or is it just hype? So neurological disorders. Experimental therapies using stem cells are being explored for stroke recovery, Parkinson's disease, and Alzheimer's, with preliminary results showing improved cognitive and motor functions in animal models. So this was coming from Frontiers in Neuroscience in 2021. So there's a lot of research that is behind this. And where you want to focus the use of stem cells for tissue and joint healing. So that's where we're going into the regenerative side. And we really want to dive into this. So one of the most exciting frontiers in stem cell therapy is it's in orthopedic and musculoskeletal conditions. This is where we see the biggest impact for our patients at Alessi Functional Health. So research shows that mesenchymal cells, also known as MSCs, derived from bone marrow or the umbilical cord tissue, can regenerate damaged cartilage, tendons, and ligaments, offering a naturally, minimally invasive alternative to surgery. So it's reducing the inflammation. So joint pain and osteoporosis. A study published in Stem Cells Translation Medicine in 2019 found that MSC injections significantly improved pain and function in knee osteoporosis patients with long-lasting effects. So another thing is tendon injuries. A lot of tendon injuries, sports-related injuries that could date back to high school days, college days, whatever it might be. But MSCs have shown to promise in accelerating healing conditions like a rotator cuff and Achilles injury. And that was from the American Journal of Sports and Medicine in 2020. So longevity and anti-aging. Stem cells are also being studied for their role in promoting tissue repair, reducing inflammation, and improving overall cardiovascular health. Key components of longevity and healthy aging. So MSCs have been found to secrete bioactive molecules that promote tissue regeneration and modulate the immune system. So Here, in conclusion, understanding the distinct characteristics and potentials of these stem cells is fundamental for advancing regenerative medicine and developing novel therapeutic strategies. The exciting applications of stem cells in joint and tissue healing, combined with their potential to enhance longevity, offer a glimpse into the future of personalized natural healthcare. So, ongoing research continues to unlock their capabilities, but aiming to translate these findings into effective clinical applications for the pain free future.
Yeah, that's right, man. And like you said, like old injuries that could be, that's what we see all the time. Somebody had something that was from a long time ago. Hey, I got in a car accident 10 years ago and they had a cervical sprain or a lumbar sprain plus some degenerative disc. And now it's snowballed into severely degenerative spinal condition. These have applications for restoring that tissue 10 years later. It's amazing. And so it's like the body's always healing. The body's always turning over new tissue. And if you can add to that, right, you can put some gasoline on the fire, you're going to speed that up, obviously. And so, there's significant advancements being made in this field. And that's kind of, the next little piece we want to talk about here. And, some of this applies to what we're doing and some of this doesn't. But either way, there's some really cool studies being done. Specifically, like one is, and I wanted to highlight this, a phase 1 trial showed the safety of stem cells in treating vision loss from a condition called retinitis pigmentosa, basically where the retina starts to get kind of worn and degenerative over time. And so people are losing their vision or the vision's becoming less effective. This can restore that. So it's pretty amazing what they're doing. And this was from the journal Stem Cells, Translational Medicine in 2021. Another really cool one was Australian scientists conducting a world first trial aiming to restore movement in paralyzed patients by implanting their own stem cells into injury sites within the spinal cord. And so this came from the Lancet of Neurology just a couple years ago in 2023. And it suggests that patients had regained partial motor function, improved quality of life from these stem cells. And so the cool thing, man, is like what is on the horizon and really kind of like what the market and patient outcomes are coming from this. And so the global stem cell market is projected to grow from 18.9 billion in 2024 to 54.7 billion in 2033, which is a growth rate of about 12.6%. And this is according to Grandview Research in 2024. And this growth is driven by obviously increased investment into regenerative medicine, but also the rising prevalence of chronic disease, right? And then the advancement in the need for different technologies. So the patient success rates that we can expect, preliminary data from clinics like DVC STEM suggest that approximately 87.5% of patients have reported sustained improvements within 3 months of therapy. And that's amazing. I mean, especially with the mesenchymal-based therapies. And this led to significant pain reduction and functional improvement in 78% of osteoarthritis patients. That is a huge number and very exciting for us, right? And we already get amazing outcomes with our patients, but the limited few that we maybe are hitting kind of a wall with, this will be able to then obviously take them to the next level. And so these findings really highlight that transformative potential that stem cell therapy has in regenerative medicine and the promising future for patient outcomes as well. And so we discussed in a previous episode how the incorporation of stem cell therapy along with our natural and alternative healing modalities is really going to amplify the results that we can achieve with our patients, helping them to avoid things like spinal surgery and recurrent steroid injections and ultimately what's called pain management, which is managing someone's pain and symptoms for a long time, right? And we do the opposite in our clinic. We want to get people back to health and ultimately live in that pain-free future.
This episode of Health Decoded is brought to you by Authentic Nutrition, the brand redefining what it means to fuel your body the right way. At Authentic Nutrition, they believe that what you put into your body matters. That's why every single product is crafted with clean, premium ingredients and dosed with maximum efficacy to ensure you're not just meeting your health goals, you're exceeding them. No fillers, no shortcuts, no gimmicks. Whether it's their advanced supplements for energy, recovery, or gut health, you can trust that what's on the label is exactly what's in the bottle. Authentic Nutrition delivers science-backed formulations that work as hard as you do. If you're tired of products that promise the world but don't deliver, it's time to make the switch to Authentic Nutrition. Elevate your health with transparency, quality, and results you can feel. Check them out today at authenticnutrition.com and use promo code Alessi15 to get 15% off. That's THENTIC nutrition.com, promo code ALESSI15 to save 15% and take the first step toward real, lasting health. Authentic Nutrition. Fuel your best self. Now back to the episode.
I think these are some of the crucial things to talk about. And then this coincides with our interpretation of what the legality comes from. So we want to always consider the ethical considerations for our patients, and then also the regulatory landscape. Whether it might be one of those scenarios where they're wrong, right? The FDA it seems to be wrong a lot of times. But we want to make sure we're in a regulatory landscape that coincides with how we're treating our patients, right? So, of course, with anything of this nature, there's an ethical debate all the time. And the use of stem cells ensuring therapies are done in the right way that is not harmful or unethical. So let's dive a little bit into the embryonic stem cells, such as the controversy over destroying embryos for research purposes and the legal restrictions in many countries right now. So there's a lot of unregulated clinics out there, right? So you definitely need a deep dive and do your own research. And there's a fine line between offering cutting edge therapies and preying on desperate people. So too many of the clinics out there make big promises without delivering those results. What frustrates me is when these places charge tens of thousands of dollars for treatments that have zero clinical backing. So at Alessi Functional Health, our priority is to practice with integrity, always, only offering treatments backed by solid science. That's why we have Health Decoded, and we bring you what is science-backed, right? If we can't stand behind it 100%, we won't offer it. Simple as that. So clinics in the U.S. and abroad offer unapproved therapies for $10,000 to $15,000, often with no scientific backing. Talked about a few where they're diluting some of their stem cell production. We want to make sure they're hyper-focused and they're going to get to that pain-free future. That's why people are taking stem cells for that regenerative therapy. So the FDA issued a warning in 2021 against unproven stem cell treatments. And only 29% of the stem cells advertised online had supporting clinical evidence. And that was according to JAMA in the 2021, which is why we partner with a company that provides the highest biologically available stem cells that have been researched for purity and delivered at a cost that is feasible for our patients. So that is one thing to note. Right now, where we're in the realm of research with stem cells, these aren't covered by insurance, right? Insurance typically is going to be more reactive care than it is proactive care. So this is really taking your body and your health very seriously when you're willing to explore these opportunities of what stem cells might do for you. So patient safety is paramount, and we always stress the importance of informed consent, that our patients know that what they are receiving and verify their credentials as well as published outcomes.
Yeah, that's huge, man. And, this is a statement I'm about to say that maybe gets our show banned, but it's like insurance wants people to stay in a moderately sick condition because that's how they can profit off of them. And what I tell every single patient who asks these insurance questions, are like, why is insurance not cover alternative? That kind of stuff. I'm like, your number one insurance is ultimately like knowing what your body is doing and making those proactive choices, right? Eating healthy, exercising, moving, getting adequate sleep. That is your insurance, right? That is your insurance against chronic disease, right? You don't need a company, a multi-million billion-dollar company who's, taking money from people all the time to tell you, how to stay healthy, right? And they don't ultimately do that anyway. So your number one insurance is be your own advocate. And then obviously emergencies happen and stuff like that. So having backup is cool. But I think I'm going to challenge listeners to think a little bit differently about what health insurance is, right? It shouldn't be, oh, if my health insurance covers it, I can do it. you shouldn't think that way, because you're going to limit yourself to a box of like, now I only do things when somebody tells me what I can do. And I'm not thinking proactively, I'm thinking reactively, like you said, versus, okay, the health insurance is there as a backup if I get into a major accident or something catastrophic happens. But I am being proactive about my health, eating healthy, moving, and doing all the things to focus on longevity, that then I need the insurance less, right? And full transparency here, I don't use health insurance. I don't have it. My health insurance is the way that I operate, and I focus on maintaining some supplemental income for the back end of that if something were to happen, right? But that's just a state of where I'm at right now. I'm not telling people to do that. I'm not advocating that. I'm just saying that take a different approach to how we think about things, and ultimately be your own health insurance first, right? And so, to kind of like summarize on this, man, like the clinic that we partnered with and that we're going to be providing these stem cells from, they are, I mean, hands down, probably some of the best people we've ever met. They're just like, all they care about is like, okay, what is the patient outcome, right? What is going to benefit the person, not us. And so we're able to get like a really good kind of financial cost breakdown for our patients, something that can be affordable and ultimately get them the outcomes that they don't have to feel like they're, going crazy out of pocket and that thing. And also the stem cells that they use. I mean, I was just going through the research and all the literature that they provided for us. Hands down the best that you can get in this country, and probably in the world, if anything, because they're using stem cells that are not altered. A lot of these companies, like you had just mentioned, are going to dilute and expand the cells. So when they expand the cell enlarges, it makes it look like there's more, but there's actually less. They're just expanded. Versus they use unexpanded. And so the cells are in their natural state. They're going to be more effective, and they're going to go to the place that need to be and actually get the job done. So, that's important to us, is like, we don't want to skimp, and we don't want to use a watered down product. Right. So making sure we're delivering the highest potentially valuable product that we can for our patients, because that's all we care about. So, in summary, really, to what we talked about, stem cell therapy holds significant promise, but requires some cautious optimism as well, right? Making sure you're doing the right research behind what kind of product you're putting into your body, and using a provider that cares about you, not just their wallet. And so making sure we're consulting qualified healthcare professionals before we consider this. What are the options? Is this right for me? All of that. And so, making sure we're staying informed.
Yeah, we always want to stay informed, stay up to date with the latest research. That's why listening to this podcast is going to help when you want to stay informed about the latest trends and activities and what it means for your health. So stem cell therapy, holds incredible potential, but it's not a magic bullet. It's up to you, right? You have to use these stem cells actively. Where stem cells are gonna get the most production is when you're exercising, when you're doing the maintenance in terms of your structural imbalances and realigning those, right? Then your body's kinetically fueling that. Your cardiovascular system's able to pump freely, and you're able to in tune with your central nervous system. So those are important things. And as always, we seek out ethical providers who prioritize patient safety and evidence-based care. As always, if you're enjoying this podcast, please like, subscribe, and share the show with anyone who's considering alternative treatments and wants to stay ahead of the curve and help the health of science.
Great word, man. And as always, head over to AlessiFXHealth.com. Sign up for our newsletter. This is going to keep you informed on everything that we're doing, the latest and greatest in natural healthcare and regenerative medicine. You can also explore more of our resources on that page as well. And send any questions you have to ask@AlessiFXHealth.com. We would love to answer them and highlight those on a future episode for you to keep you informed and keep you knowledgeable on this subject. As always, stay curious, stay empowered, and remember that your health is in your hands.
Thank you for tuning in to Health Decoded, where we break down the truth about all things health and empower you to take charge of your well-being. If you found value in today's episode, please subscribe, leave a review, and share it with someone who needs to hear this. For more resources and personalized support, visit us at AlessiFunctionalHealth.com and sign up for our newsletter. To hear your questions answered live on the show, send them to ask@alessifxhealth.com. That's ask@alessifxhealth.com. Until next time, stay curious, stay empowered, and remember, your health is in your hands.